here, even though the situation is quite bad outside. Okay, so my name is Imran Mahalil, and I'd like to present on comparative study of the effectiveness between VR visualization and imaginary techniques to treat stress problems. So basically, there are 7 points here which I have laid out. The first point, in order to understand more about my research, is that what is stress? Okay, so generally, stress is an adverse condition that leads to mental, emotional, or physical resistance. So this is a quick survey on stress in the US, which can be applied usually all over the world, because when they work, 69% says they are stressed when they are working, and 30% says they are low. So more or less, stress is very subjective, because we all feel, like for example, when we go to work and we can't find a parking, so maybe we feel stressed just because we can't find a parking, but to some other people, they feel stressed, maybe it varies, it's quite subjective. Okay, next. Okay. The next key point is, what is imaginary therapy? Okay, so basically imaginary therapy is that even we have probably felt imaginary therapy in our life. When we lie down on a chair comfortably and maybe our friend talk to us and we just listen to our friend while we close our eyes and we feel comfort. So this research on imaginary therapy is that it actually works and it actually does reduces stress. So in this comic here that I placed here is that this is a bit more advanced, because this person, while he's lying down, he's actually talking to an imaginary doctor. So there's a bit more advanced, because this doctor here doesn't even exist. But in certain cases, even this actually works. It does reduces stress. Next. So this is the real imaginary techniques. How they actually conduct this therapy is that when they go to the clinic or medical center or hospital, the patient lies down comfortably and they close their eyes while the doctor instruct them. For example, imagine a scene like you're walking in a beautiful forest, but your eyes are closed. So you have to imagine the scenery. If the weakness about this therapy is that it's completely based on how you imagine the scene. So if your imagination, if the patient cannot imagine the scene properly as how the doctors describe, it may not be fully effective. So the next key word is virtual reality therapy. In short, VRT. So what VRT is that the patient lies down comfortably on a chair or a bed or anything while we use a computer system to visualize what the patients can see. Usually using a HMD, head-mounted display, this object, you can only see what the computer wants you to see, because when you wear it, it usually surrounds your surrounding. You cannot be distracted, oh, I can see a door or I can see somebody walking, because the HMD will cover your eyes completely. So it has been reported that 82% of 1 to 123 patients in Duke University Medical Center, that the patients would actually come back for this VRT therapy. So this is actually proof that it is effective and it does produce a positive feedback using virtual reality. Next. So this is another example in Webster University. So what happens is that while the patient is lying comfortably, the computer can actually monitor everything. Your blood pressure, whether the person is stressed, the doctor can mediate it without disturbing the patient, without telling or without asking any question. The computer system has precise data and result and accuracy. Next. Okay, this is an example of the US Army using virtual reality therapy. So what happens is that the soldiers actually use this therapy and it does produce positive outcome for the soldiers. So in this point here is that virtual reality can be used from many types of places, hospital, military bases, university. In fact, some people actually use it in their own private homes. Next. Okay, I'm going to talk about computer-generated imagery. So all these pictures which I've laid down is from Avatar, and what they have done is that they have used computer to generate images. So this is an example of how brilliant computer can actually generate what the director wants us to visualize. Because imaginary therapy, if the director, in this case Jim Cameron, so if he asks us to close our eyes and imagine the floating mountains, of course we cannot exactly imagine it as beautiful as how he wants us to visualize it. So this is an example of how powerful computers can generate image. Next. So for VR visualization, this is an example of my project that we've created, and we use CryEngine as an open source virtual reality to create stress-free environment. So in the picture on the left is a VR motion sickness is taken under consideration. It means that there are many virtual reality therapy that already exist. And yes, some people when they wear the HMD, they do feel motion sickness, so it may not be effective. But we have researched the standard motion sickness. So we plan to implement how the movement, whether they feel sick in the VR system. So basically, VR is a very powerful tool that does influence our mind. So imaginary therapy is very much restricted to our imagination, to our mind. Okay? The next is, what is the research about? So the research is to compare the effectiveness between VR, the picture on the left is VR, and imaginary techniques to treat stress. So what happens is that I'm going to try to compare this method of therapy, virtual reality, compared to imaginary. And the question is that, which is more effective to reduce stress? So according to this medical center, as I mentioned before, is that they did conduct certain reports, and however, they did not compare those reports to the imaginary therapy. Okay, so for comparison methodology. So basically, there are 3 stages in which to conduct the research. The first stage is that there are 2 groups. Group A of patients will be asked to undergo treatment using imaginary techniques. So what happens is that there will be a group of patients that will wear a headset, and they will need to close their eyes and listen to what the therapy will be told. The second batch, group B, these patients will go through a VR, which there's a picture of me testing our system, and this is the actual environment which is running. So we will see, based on the similar script, like if they ask to close our eyes and imagine a forest, but the VR, you don't have to close their eyes, they just need to wear the helmet and enjoy the view of what is shown. Of course, maybe it's not the level of Avatar, but we try to make it as best as we can. So the final stage is that a survey by using Likert skill will be conducted to evaluate, and we will use t-test analysis. And we have a doctor in this research as well, so he advised us to use blood pressure after and before the therapy session to actually test if the heart rate has decreased or in fact it may increase for certain people because certain people have a different level of stress. Conclusion. Okay, so in conclusion, this research proposed a comparison study of the two treatment techniques between imagination and visualization using VR. A methodology on how the comparison will be conducted is also described. So it is anticipated that VR is in fact more effective than imagination. So that, and Steve. So basically, this is all my process. Okay, so I'm going to display